Hi, it's Annastacia Palaszczuk here, and today I'm joined with Dr. Jeannette Young, and of course today is a very exciting day. Our very first Pfizer vaccine was handed out on the Gold Coast to young Zoe. And a very exciting day, Dr. Young, and you were down there firsthand.
I was. It was brilliant, Premier. It was so good to see because, of course, this was the hospital that had the first cases that first came in from Wuhan. And now they're the first hospital to roll out the vaccine. And they did a brilliant job this morning. They drew it up perfectly and they gave it, and it went very, very well.
So Queensland, we're well underway, and of course it's going to be rolled out progressively up until the end of October. But what we are relying on is for the federal government to give us that supply. So we're working in tandem, it's a shared responsibility, and of course that's our priority, to ensure that every Queenslander over the age of 18 gets that vaccine progressively over the next 6 months, Dr. Young.
It is very exciting. So today they're planning to vaccinate 180 people at the Gold Coast. I gave them a target of 100. They've gone beyond that.
Excellent.
Very good. Then on Wednesday we're going to the PA hospital and starting there again with a target of 100, and then on Friday Cairns with a target of 100. Then we go to another 3 hubs next week, and then we gradually roll out through the state. But we're starting with 1,000 people will be vaccinated this week, rapidly going up to 10,000 per week, and in the first 6 weeks we hope to have achieved all of our key people who need to be vaccinated to protect every single one of us, the 37,000 frontline workers and hotel quarantine workers, and also the Commonwealth at the same time is vaccinating 88,000 residents and staff in disability accommodation and aged care accommodation because they're the most vulnerable. So it's very exciting.
All right, well, now we've got some questions from the public, and this is the opportunity for the public to ask questions. And the first one is from Natasha, and she says, can you choose which vaccine you get? Is one better than the other?
Well, Premier, it's a very, very important question and a very sensible question, but there's no difference. They're both absolutely fantastic vaccines, and I personally don't know which one I would prefer.
So you would have either?
I'd have either, whichever one's offered. It's more important to have the first one offered than to pick and choose, but actually there's no difference. They're both fantastic vaccines, effective and safe.
Our next question is from Melissa. She's asked, how effective is the vaccine in preventing coronavirus? Is the AstraZeneca vaccine going to work against variants like the South African variant?
We don't quite know, but we do know that both vaccines are very effective at preventing severe illness and death.
And that's important.
That's what you want from a vaccine. We're not sure yet how effective they are at stopping people getting any infection so that they don't spread it. So actually the important message out of that is don't rely on everyone else being vaccinated, just get vaccinated yourself, because then you'll stop yourself getting really sick and dying, and that's what we want.
Our next question is from Rochelle. How are we getting notified it's our turn so we know it's not a scam? This is a really important question because I was at my local bakery yesterday, and the first question the person asked me was, when am I getting vaccinated? When is it my turn? So this is a really, really important issue, Dr. Young.
Well, the first part of it, how do you know it's not a scam? If you get asked for money, it's a scam. Every single person in Queensland will get this vaccine for free, whether they go to a pharmacy, a GP, a hospital, a Commonwealth clinic, it's free. So if you get asked for money, it's a scam. Now, in terms of knowing when to come forward, in that first critical group of 37,000, we'll be contacting you. You'll get a text message, you'll get a phone call, you'll be told you need to come forward. It's really important. After that, we'll get messaging out telling people when they should come forward. And remember, the majority of people are actually just going to go to their normal GP. So they'll be able to go and speak to their GP and talk to them about it.
Our next question is from Jules. Has the vaccine been tested properly?
Of course. It's been very, very thoroughly tested on tens and tens of thousands of people. Now we're up to millions of people. It's gone through every process that a vaccine ever is required to go through. What's happened here is that governments, like the Queensland government, like the federal government, governments throughout the world have poured money in. And that has meant that each step could be done so much more quickly. You could move on to the next step without having completed the last one, because you could start going and then you get the results from the last one. So there were no gaps. That's why it's happened so quickly. Every single test that's ever required was done. There were no shortcuts.
And it's rigorous testing. I just think we need to reassure the community that that's all done independent of government. And it's when they say it's fine to go, it's fine to go.
Absolutely. The TGA is the most rigorous regulatory authority in the world. They are really, really nitpicky, if I could put it like that. They go through everything, and when they say something's safe, it's absolutely safe.
Our next question, Dr. Young, is from Sam. Am I able to get my second vaccine jab interstate? I'm going on a road trip over several months.
If it's the AstraZeneca, yes. If it's the Pfizer, I'm not sure, because the Pfizer has to be delivered at specific hubs and you have a 21-day gap. The AstraZeneca will be able to be delivered through most places, through pharmacies, GPs, everywhere. So if it's the AstraZeneca and you need to wait 12 weeks for that one, yes, I don't think that there'll be any problem with that.
Our next question is from Betty. Do we still need a flu shot? Because, Dr. Young, there hasn't been much flu around at the moment because of COVID, but I'm quite sure we're going to start seeing the flu in years to come.
We will. As soon as we see those international borders, we'll see flu. It's really, really important that people also have the flu shot, because you definitely don't want to get both. Your outcomes are they're 6 times worse if you end up with both. So you do both diseases. So you do need to get the flu shot. You do have to have a 2-week gap. Doesn't matter what order, but you've got to have a 2-week gap between either of your shots for COVID and the flu shot. So you just have to time things.
And our last question is from Jacinta. Do they know the risk for those with other health problems? It's another good question.
It's a very good one. And this is not a health problem. This is actually something that a lot of us really want to happen, and that's pregnancy. So at this point in time, we're not recommending that pregnant women or women wanting to fall pregnant have the shot without speaking to their treating doctor. So that's really important. For other people who have other health problems, we want you to get vaccinated. For some of them, you might need to actually have both doses before you start a treatment, say chemotherapy. So just speak to your doctor about that. There's a very important document that I'd like every Queenslander to have a look at, and it'll be available tonight. And that shows all the different stages of the rollout and who's in each stage. So the first stage in phase 1A is the critical one for every Queenslander to know about. So that's 37,000 workers in our hotels, in our hospitals, the people who are dealing with potential cases. And if we get them all vaccinated, which we intend to, that will protect every Queenslander. Then there are the aged care and disability accommodation workers and the residents. And the Commonwealth has started vaccinating them. They're the most vulnerable people. Then we go to phase 1B, which is around 1 million Queenslanders. So that's every Queenslander who's 70 years of age or over, because we know that's a high risk. That's the remaining healthcare workers out in our system, public and private. Aboriginal and Torres Strait Islanders who are over 55 years of age, younger adults below that 70 age group with underlying severe medical conditions. And then the last group are our really critical and high risk workers. So that's police, fire, emergency services, defence. So they're in the next phase. Then we'll come to the phase after that, phase 2A, which is another around 1.25 million Queenslanders. So that's people aged 50 years and above. It's First Nations people who are aged 18 or older, and any remaining critical and high-risk workers. Then finally we'll come to phase 2B, which is the rest of the adult population of Queensland, which is around 1.5 million Queenslanders. So that's hopefully every single adult in Queensland will be vaccinated by that time. The last phase we're not sure about yet. We need to get more information. That's about children. So that's under 18. We need to find out with more trials and more assessment whether or not we should be vaccinating that group. And I'm not concerned about that group for two reasons. One, we know that they don't get serious disease, which is good, but they can still get it and spread it, which might be a reason that we vaccinate them. But also we know in Queensland we can vaccinate children through our schools, through our GPs, through a whole range of processes. That's easily done. So everyone, try and get a hold of this document. We'll put it out there everywhere because it'll give you an idea of when you might be vaccinated. The first phase will take around 4 to 6 weeks.
Well, thanks everyone for joining us live and for sending through your questions. That's all we have time for, but we will absolutely keep you updated as the rollout continues. And can I take this opportunity to thank Dr. Young for joining us here today, and we look forward to keeping Queenslanders up to date every single step of the way. Thank you and good night.
Just get it. Everyone needs to get the vaccine. And, you know, if you want to travel again, which I'm sure a lot of you guys all will want to, you're going to have this anyway. My name's Zoe Park. I'm a registered nurse and I work on D5 North, which is the COVID ward for the Gold Coast Hospital. It's been a very challenging year. There's been lots of changes and it's been tough. It's been scary at times as well, but yeah, hopefully we're now coming towards the end of what's been a really challenging year. Getting the vaccine today was a privilege and an honour and just so exciting. I'm so happy that I was able to get it. It's probably the best vaccine I've had. Like even now I can't even tell I've had it. It didn't hurt at all. It was, yeah, it's nothing like the flu shot. It's a lot better.